Hello, my name is Olia Burtaev. The following presentation will be informing the reader on a recent client consultation I had with my new patient Katerina and her goal to improve on current lifestyle habits, diet and cycling performance. The client consultation overview will discuss information provided about my client for further evaluation and exercise prescription. Information regarding my client will include the client screen, pre-exercise screening tools, client exercise history and goals, a needs analysis for cycling, and to conclude the practitioner goals and action plans mandatory for success. Katerina is a female student who is 18 years old. She currently has a height of 180 centimeters and a weight of 70 kilograms. Her BMI score is 21. She has a waist circumference of 73 centimeters and a blood pressure score of 122/79. Currently, all measurements are considered in the healthy and normal range. The following dot points were highlighted in the new client screen. My client is wanting to improve in various fitness components, including cardiovascular endurance, muscle strength and power, as well as gain lean muscle mass and reduce body fat. Currently, a first-year student, Katerina, is wanting to modify her current lifestyle and improve in fitness levels, enhancing her performance. She spends up to 6 hours seated at a computer while studying, therefore is wanting to change and adapt to a new diet. Additionally, she hopes these adjustments will assist in weight loss. Sometimes she experiences dizziness and feeling faint. This was confirmed by the PAR-Q questionnaire. My patient has received a physician's clearance to engage in moderate physical activity when required. Furthermore, Katerina experienced tight hip flexors, resulting in discomfort and affecting her performance. Current physical activity status. Currently, my patient performs 2 sessions a week for 60 minutes of moderate to rigorous cycling sessions, as well as in addition 1 session of 45 minutes of Pilates to assist with hip mobility and flexibility. Therefore, my client's current PA status meets standard recommendations. The Physical Activity Readiness Questionnaire consists of 7 questions, to which, if any answered yes to, medical attention must be sought, followed by medical clearance provided. My patient answered yes to questions 4 and 5, confirming that she does feel dizzy and tends to lose balance, as well as having joint problems in her hip, which potentially affect not only her cycling performance but also ADLs. The ESSA comprehensive pre-screening tool determined Katerina's current risk assessment by identifying any signs or symptoms of known diseases. As stated earlier, Katerina answered yes to feeling faint and dizzy, which may lead to losing balance. Her risk factors totalled up to -2, classifying her at low risk, therefore allowing her to participate in aerobic physical activity at moderate to rigorous intensities. The final pre-screening test conducted was a lifestyle and behaviour checklist. My client achieved a total score of 62 points, which classified her in the good category, however still meaning that there is room for improvement. My patient's goals were highlighted in 3 different categories. Health. My client is wanting to improve on her current diet and reduce the intake of processed foods to suit her lifestyle. Additionally, she will be seeing a dietitian once a week to assist with weight management. Physical. Improve overall cycling performance. This will include an increase in cardiovascular endurance and lower limb muscle strength, as well as an increase in hip flexibility and mobility. This will additionally change in body composition by decreasing fat mass and increasing lean muscle. Behavioural. Adhere to the exercise program, prescribed diet whilst improving exercise capacity. It has been evident that cycling is a sport which has an extremely high demand for high rates of energy expenditure at a high economy of effort for a prolonged duration of time. It involves a complex interaction between physiological components including maximal oxygen consumption, lactate threshold, and mechanical efficiency. Evidently, it has been proven that cycling stresses the aerobic system due to the endurance nature of the sport. Movement patterns include high pedal cadence and high power to body weight ratio. A study conducted in 2009 confirms that Australian cyclists have achieved approximately a peak power output of 291 watts. The training method adapted for optimal cycling performance involves long-term low to intensive cycling training. This method has been proven to be effective in improving endurance performance. The ideal body composition for individuals who partake in this sport involve a low body mass and body fat percentage. My patient will be required to undertake anthropometric assessment to monitor the progression throughout the training sessions and new diet plan. To conclude, the action plan was comprised of the following recommendations in order for my client to progress and succeed in her desired goals. Anthropometric assessment including BMI and waist circumference measurements. Referral to a dietitian once a week to assist in weight loss management. Maintaining a training diary throughout the season including current diet and eating plan. Review of the weekly progress must be done at the end of each week. Low volume and high interval training must be conducted 3 times a week. However, taking into consideration that my patient may feel lightheaded and dizzy, she may perform this exercise at a low resistance of 30 watts. When gait testing performed on cycle ergometer, physiological components including VO2 max and blood lactate threshold must be monitored and noted throughout the season of training.